Can it be given to over 65 person? After Kybella, do we need surgery to remove skin sag?
Thank you for your question. You submitted a question where you're asking that if you get Kybella over the age of 65, will you need surgery to address the sagging skin? Well, I think you're definitely on the right track by asking this question. It's very important to understand that when new drugs or new devices show up on the market and have this incredible promise of displacing surgery, that the principles of human anatomy, physiology, and the issues of aging still always apply. So how I'm educating my patients about Kybella, the drug that's supposed to help reduce fat by literally dissolving it by injection, is that if a person is a candidate for liposuction, in other words, if they have a little extra fat under the chin, but they have good skin tone, then if I were to suction out that area and the skin would retract upward, then they could potentially be a candidate for Kybella. Now, my personal bias is that although the data remains to be fully seen from many more people using it, is that with under the chin or submental fat, if you have a limited amount under the chin, well, the surgical approach is not that different from getting an injection. It's a little bit of local anesthesia, and in approximately less than a half an hour you can get everything done. But Kybella does offer this opportunity for people who want to try something that's non-surgical, which means people have to come back for injections over and over, and it remains to be seen how consistent and predictable it'll be. For someone who's over 65, usually the skin is not that resilient. Basically, you're dealing with the second aspect of facial aging. The first is being volume loss. That's why people in their 40s can look better by having volume correction. So if you're losing bone, muscle, fat in the face, everything's going in, you add volume. When you're beyond that, there's more descent. There's sagging, loss of definition of jawline, extra neck skin. For those patients, ultimately they need some kind of a facelifting procedure. And so if you think it through, if you get Kybella, then you'll still have the sagging skin, and the overall look will probably be not much better. In fact, it's pretty much well known amongst cosmetic surgery colleagues that the wrong procedure for the patient can often make them look worse. So if someone feels like they have too much skin under their chin, and we've seen this many times, they'll get liposuctioned, and then the patient is stuck with what appears to be more excess skin. And it's because the volume almost added some contour, and then without that, the skin just kind of is loose. So proper diagnosis and proper counseling is key. It's always exciting, as I said before, that something comes out that has some promise. But it's always, being in practice for over 20 years, practicing in Manhattan and Long Island, I've seen a lot of things come and go, whether it was endermology, whether it was thread lifts, whether it's the many different thermal devices which are more and more showing how ineffective they are. They can't lift skin like a facelift. The principles of doing the right thing for the right reasons, for the right candidate, withstand the test of time. So it's very important that you meet with qualified, experienced cosmetic surgeons and discuss this new modality, this drug, and see how it fits for you in the context of your concerns. But if you're over 65, most likely you need some type of surgical procedure, and that's dependent on the presence of jowling, extra skin, platysmal bands, and all the other factors that people get as we get older. So I hope that was helpful. I wish you the best of luck, and thank you for your question.